Today we're going to talk about allergies and two types of allergies, environmental allergies and food allergies. And I'm going to change the word allergies with food to food sensitivities because there's different types of food reactions. So with that, I'm Dr. Kian and a graduate of Basta University and a naturopathic doctor. We are primary care doctors that focus on prevention and treating general health problems at their root cause. So welcome. There's the handout right here. There you go. All right, so this is our outline for today. We're going to talk about the different types of allergies, the causes, the symptoms, the different types in terms of sensitivities, environmental, and then how to test for it and how to treat it. And just in case you're not familiar with naturopathic medicine, it's a type of medicine that blends thousands of years of wisdom, traditional wisdom, with current scientific advances, and it covers anywhere from family health to perinatal to geriatric care. And the type of doctors that practice this kind of medicine are naturopathic doctors, or ND in their short form. And in California and many other states in the US, they are considered primary care doctors. They have attended a 4-year postgraduate naturopathic medical school, and in addition to the standard curriculum, they have training in natural therapies. So what makes us unique is that we focus a lot on natural therapies like nutrition, and you could see here brackets I put hypoallergenic diet because some people have food allergies, and when they eat certain foods they actually have strong reactions, and that's when we realize let food be our medicine, right? That food has a huge effect on our body. We can use medical nutrition, so vitamins and nutrients to help treat health conditions. We use herbal medicine, homeopathy. I'll actually talk about this today. In some of the other talks I haven't mentioned homeopathy, but it's really effective in this lecture, so I'll talk about that with the treatments. We can do hydrotherapy, physical medicine, therapeutic exercise, counseling, a lot of focus on lifestyle and stress management. And then there's a time and place where we might need to use pharmaceutical agents. So, we got like a broad spectrum of how we address therapies. And then this is the philosophy that we follow. The first one is to use the healing power of nature, so use therapies that help the body heal itself. And then the main one, first do no harm, find and treat the cause. So welcome. I'm going to leave this maybe right here. Okay, I'll just leave this right there a little bit. Okay. Find and treat the cause. Hi, welcome. And then treat the whole person. This actually will come handy today too. Interestingly, when we're under stress, we're more sensitive to foods that we may be allergic to. So I'll talk about how we can balance the foods that we have problems with depending on our life situation. And then we'll talk about prevention, and then the word doctor in Latin, which is to teach. So that's why we're here today. So in terms of definition, allergy is basically an abnormal reaction that your immune system has to an allergen that can be either eaten or breathed. And it can lead to a bunch of inflammatory responses. And an allergen is any substance that your immune system sees as foreign. So it could be things like dust, pollen, certain plants, medications, foods, insect venoms, like bee stings. And then allergic reaction is basically your body's immune system that responds to the allergen, seeing it as an invader, and it could lead to a bunch of symptoms, as we know of anyone who's had hay fever, with headaches, sneezing, sinus problems, congestion, but it can even be more serious, like an anaphylactic reaction, like your throat closing or your tongue swelling. So that could be pretty serious. So I want to separate the different types of allergies. So you can see there's two main categories. One is that your immune system's involved with one of them. The other one, your immune system is not involved. So when we talk about a food intolerance, like lactose intolerance, that's not related to your immune system. That's actually an enzyme. So that's why you've heard of lactate, that milk. So they add extra enzymes to the milk and it helps you digest it. So an enzyme deficiency is not related to your immune system. But with the immune system, we've got two different types of allergies. There's IgE and then there's IgG. This one's more severe. You can see within 2 hours of less of consuming that food, you're gonna get a very severe reaction. So it could be anaphylactic, like I mentioned, tongue swelling, or your throat closing, very quick, like that peanut allergy we talk about, right? And then the IgG is more of a delayed sensitivity. This is the area I'm gonna talk a lot about today because most people don't know about it. And you could see symptoms take 2 to 72 hours to take place. So it's like 3 days apart, right? So you could be eating a food and then 2 days later have a reaction, and you can't even figure out when it was that you ate the food. So it's a really hard one to correlate, and that's how we're gonna figure out today how to make that connection. So as I said, with the IgG, it's fairly quick, within 2 to 3 hours, and the reactions are very severe. So if people have asthma or like a hives, like that kind of a rash, swelling, acute GI distress, you want to think more of maybe it's an IgE related, especially if it's very quick from the onset of that food. So you can see the relationship between the offending food and the symptom is usually more clear. Whereas if you look, actually, just to stay with that, part of the reason with that is if you look at your cell, you can see that it has a receptor. So here's the receptor to the cell, and that IgE that we talked about binds to the cell. I'm sorry, the IgG is here. The allergen binds to the IgE, and then it triggers a release of histamine. So you've heard of antihistamines? Histamine basically triggers all this inflammatory response, whether it's itching, sneezing, your mucus formation in the nose, all that hay fever nuisance, right? So an antihistamine blocks the effect that histamine has on different parts of your system. And just another picture here, you could see, here's the allergen, it binds to the IgE receptor, releases histamine, and then you've got mucus secretion, you've got blood vessels like swelling, you've got your respiratory tract that can close up and cause either asthma or difficulty breathing, or you can have a rash, itchiness and rash. Whereas with the IgG, it's more delayed, usually peaks around 12 to 24 hours. So within a day, you should have an idea that, okay, maybe in the last 24 hours, there's something that I ate, that's why I don't feel as good today. So you could do a little bit more detective work, but it could go up to 72 hours. And it's, you know, I kind of put this thing, it could silently take over your health and you may not know it. A lot of people say, I'm tired all the time, or I have this chronic digestive problem, and they've been from one doctor to another and they've ruled out all the other health elements, and it could have been some kind of a food reaction like gluten sensitivity or dairy allergy or egg, you know, something that they've been eating all their lives and not realize that it's leading to like these subtle reactions. So you can see that the reactions are a lot more low grade and chronic, and it could be very vague. Excuse me. It could be fatigue, malaise, headaches, difficulty with metabolism, intense food cravings, digestive problems, eczema, trouble concentrating. A lot of people notice that once the food allergy gets taken away, they just feel like they're a lot more focused. And that's actually something I've heard my patients say. They feel like they were run over by a truck, like when they ate the wrong food, especially if they have a really bad gluten sensitivity. They'll eat the gluten and they're like, I feel like I'm exhausted, like I have flu-like symptoms. So if you can discover a food allergies, it can profoundly change your life. These are some examples of other symptoms that may be related to food sensitivities. So could be chronic nausea, vomiting, diarrhea, constipation, bloating, stomach pains, cramps, acid reflux, very common. Emotionally, could be mood swings, anxiety, depression, irritability. You know, many cases of ADHD can be related to food sensitivity, so that's a big one. And then it can also actually affect our behavior, so it might lead to binge drinking or eating or certain food cravings. And then with other systems of the body, so it could cause itchy, watery eyes, you know, hearing, not necessarily hearing loss, but ringing in the ears, sometimes I've seen related. Chronic nasal congestion, so people who drink a lot of dairy, sometimes it's very mucus forming, and if you're allergic, they just feel like they can't breathe at night. So you can see excessive mucus formation, coughing, sore throats, chronic colds. If someone gets colds over and over and over, there might be something they're eating every day that makes their immune system weak. So if we find out what that food allergen is, a lot of times it's something people like, you know, I feel bad, but we discover that they have like a milk allergy and it's like, okay, no dairy for you, or maybe gluten, or just something that they really like, eggs. And, you know, I feel bad taking it away, but the point being is that when I do, their immune system gets stronger. And then they used to get colds maybe 5-6 times a year, and it affected their quality of life, and they, you know, getting a cold, you know, sucks, right? So then suddenly we look back a year, and it's like, hey, you've barely gotten sick this year. That was worth cutting back foods. And today we'll talk about, well, if you have certain food reactions, how can we substitute gluten with gluten-free foods, or dairy with dairy-free foods? That way you don't feel like you're feeling deprived. We can just find substitutions. This is also a big one. Hives, eczema, acne, those are all potential reactions to food sensitivities. Poor memory, concentration, chronic infections, as I mentioned, really big chronic ear infections in children, really important to look at food sensitivities. And then I've seen vertigo, chronic dizziness be a problem. Bedwetting, also another big one for kids. Chronic bedwetting may be related to food allergies. Chronic fatigue, arthritis. Okay, so I put this bucket here, and I want you guys to start thinking about the term total load, in that sometimes we might have mild reactions to food that, you know, you notice once in a while you can eat it and you're okay, but other times it's a problem and you're like, you don't see a consistent response, and it may be related to something else. So if you're under a lot of stress at some point, your body may not be able to handle it, but if you're in a better situation, your body has more reserves. So the total load is kind of like a bucket where one factor and another factor kind of leads the barrel to overflow. So you can see for some individuals, a single exposure to the antigen may not be a problem, but if it's 2 or more, it suddenly leads to symptomatic release, as if like the bucket is overflowing. Okay, so then you might ask the question of, okay, if I have food allergies, what may be the cause of it? These are some of the causes that have been documented. It could start very early, as introducing solid foods to babies too early, or not breastfeeding long enough. There's actually an order in which we recommend to reintroduce foods to babies. Dairy should be delayed as long as you can. I mean, you're better off introducing goat milk rather than dairy, because the protein molecule is slightly different. So delaying cow's milk can be very helpful. Maternal transfer, so if the infant has, let's say, eczema, or gets frequent colds, ear infections, it may be that the mom has allergies and she's passing her allergies through breast milk. So we sometimes may have to treat the mom, and then the baby will benefit. Stress, mental, emotional, physical stress. Some people, they can tolerate certain foods as soon as they're under stress. They're traveling, their lifestyle changes, they become reactive to food. So that's part of that bucket. Alcohol and smoking, so it's like all these factors overflowing the bucket. Chemical pollution, air, water, and food. That's actually a big one. I think our environment's a little bit more conducive to getting allergies. I think that's part of the reason perhaps this generation has more sensitivities than we used to. And I think especially with GMOs, genetic modified organisms, or processed foods, we're just affecting our body more and having our immune system be more vulnerable. So there is a genetic inheritance, it does run across families, and obviously having a weak immune system makes you more susceptible to food sensitivities. So as we know, Hippocrates, the father of medicine, he's got some really brilliant quotes, and this one's really relevant. So he first said, "Let food be your medicine and medicine your food." But then if you look at the other quote, he said, "One man's food is another man's poison." So it's not all equal. But I love the next quote that he had. So he was actually the first to recognize food sensitivities, in that he observed that milk could cause gastric upset and rash. And if you look at this quote, he said, "To many this has been the commencement of a serious disease, when they have merely taken twice in a day the same food they wish have been used to taking once." So it's like a volume issue. So we could probably the take-home message would be the same. If we eat the same thing over and over and over, we're more likely to develop sensitivities than if we eat a variety of food. So that's really the message I want to get out today. And I'm going to talk about how we can increase the variety of our diet. Okay, so another theory that we think why allergies are developing, if you look at the ancient time, we had the hunter-gatherer type of diet, and now we're more of like an agricultural society. And if you look at the foods that were common allergens, it's soy, wheat, dairy, the agricultural kind of foods. I rarely see the hunter-gatherer style foods be an allergen. Rarely see vegetables and fruits be a problem. Rarely see meats be a problem. So I think our genes haven't quite adapted to it. But another problem is that even if it adapted, we're mass marketing a lot of these foods. A lot of it is processed, and we're eating it in a, the way it's made isn't even good quality, and we're eating it really fast. Our lifestyle is fast-paced, competitive. It's like stress, stress, stress. Our body's just not adapting. So that's a big one, especially because your diet has a huge impact on how you feel. So you could go your day feeling really alert and awake, or you could be feeling fatigued and having mental fog, and your diet could make all the difference between the two. So kind of backtracking again, how do we address why does our food affect our immune system? Well, first of all, 70% of our body's immune system's in our digestive tract. So if you eat something and it goes in your digestive tract and your immune system has an effect systemically, of course you're going to have reactions throughout your body. So the first place we always want to go to is looking at balancing digestion. And if you really look at the cells of the digestive tract, they're called GALT. It's the gut-associated lymphoid tissue. And these produce immune cells, and they also attack infectious agents. This is a really cool fact. Have you guys heard of probiotics? Yeah. 3.5 pounds of our intestinal flora is made up of probiotics. 3.5 pounds. So sometimes, it's not that we don't have any intestinal flora when we take antibiotics, but the more we take antibiotics, the more we kill these good bacteria. So even if it's, a pound less, it's still quite a bit. I mean, we're talking billions and billions of organisms that are helping us balance the good and bad bacteria. So these guys are on your side, and sometimes I find that when we balance the good bacteria, we're not as susceptible to food sensitivities. This tends to be disrupted with, like I said, antibiotics, but also high processed foods tend to kill them quite a bit. And birth control pills, even NSAIDs like aspirin, ibuprofen, they can definitely affect the lining of the gut. And then you can see poor digestion could also play a role. So low stomach acid, people who take antacids because they have heartburn, they actually artificially lower their stomach acid. So that could play a role in how they digest foods and break it down. And then reduced levels of digestive enzymes, poor bowel function like constipation or diarrhea. And then I'm going to talk about this term leaky gut, in that if you have leaky gut, you're more susceptible to food sensitivities. But if you have food sensitivities, you want to treat leaky gut. It's kind of like a vicious cycle. So we'll talk about this right now. So the other term for this term is intestinal permeability. And what that means is that the lining of your intestines are bound together by tight junction. It's tight enough that doesn't allow large molecules to leak through your blood until it gets broken down by digestion, right? You guys have studied digestion in school? Yeah, so food gets broken down by enzymes. So your intestines wait till it's small enough, and then it goes through that lining. But if there's damage to that lining, before it breaks down, those large molecules enter the bloodstream. And then your immune system says, you look different to me, I don't recognize you. And it's almost like it starts to attack it like it's foreign. And when that happens, your immune system's hyperactive. And it's the same thing with allergies. Allergies are hyperactive immunity. So the first place to calm the immune system down is to address the leaky gut. That way your immune system has one less thing it has to do. And that's a message I take home for people, is if they have both environmental allergies and food allergies, it's almost the same theme. The thing you can control is the food, right? It's hard to control all the pollen and everything growing in the air. So it's like the bucket. If you control your food allergies, the load goes down and your body has more energy to be able to handle all the pollen and things in the air. And then this picture kind of goes over what the leaky gut is. So here is one cell in your intestines, here's another cell, and you could see there's like these holes. So these large molecules enter the blood, and then it causes these inflammatory reactions that we call allergies. So the molecules could be bacteria, it could be undigested foods like proteins and fats, and then for some people it could trigger autoimmune reaction, like we think that potentially rheumatoid arthritis or lupus or colitis, those could be related to leaky gut. So a lot of times we address leaky gut to address autoimmune disease, but it could just even be general allergies like skin rashes, joint pain, bloating, generally feeling fatigued or having mental fog. They could all be related. I showed this in the last talk if you guys were here, but it's kind of a vicious cycle. So if you look at the top one, it says leaky gut. And one way of getting leaky gut, as I mentioned, is through consuming too many aspirin or ibuprofen. Certain drugs can damage the lining of the gut. So let's say that the person has leaky gut, and then look over there, it says chemical and food sensitivities. And then if they have these sensitivities, your body releases histamine, right? Then histamine actually causes pain. Histamine causes inflammation, inflammation causes pain. If the person's in pain, what are they gonna do? They're gonna take more aspirin. And then more aspirin is gonna cause more leaky gut, it continues. Last thing we wanna do is take people's aspirin away and say you could just suffer with pain. That's not the point. We wanna address the leaky gut. When the inflammation goes down, they'll find that they won't need to take as much aspirin, and then as a result, the leaky gut heals. So we just want to end that vicious cycle. And a lot of times if we take the food sensitivities away, that also heals the leaky gut. So both aspirin and food sensitivities can make that leaky gut worse. So some of the causes of leaky gut, it could be chronic stress, and I think stress can just trigger a lot of inflammatory mediators. So stress, chronic inflammation, food sensitivities, infections can damage the lining of the gut, small intestinal bacterial overgrowth, which is a particular bacteria that affects the intestinal walls, environmental contaminants. This could be pesticides, it could be growth hormones, could be any chemicals that we ingest. That is a contaminant. Excess alcohol, poor diet like processed foods, aspirin, other medications, and poor immune function. All of this can damage the lining of the gut. Okay, so I'm going to skip over a little bit to another area, which is environmental allergies, and then we're going to bring it together. So this is an area that's a little bit more frustrating for people, because if it's food allergies, you could just stop eating it, but this you can't control. Some of it you can anyway, like grass, molds, certain trees, weeds. If you have a pet and you're allergic to it and you love your pet, sometimes it's like you're willing to put up with the symptoms if it's a pet. So there's certain things we can do. It's kind of like having your cake and eating it too. It's like you can keep your pet, but you could address allergies from a different angle. So these are some examples of environmental allergies, both indoor and outdoor. The path to this is a little bit different. It is related to histamine response. That's why people take the Claritins or any antihistamine, and they have some symptom relief. So the way we want to treat this is by lowering histamine reaction, but keep in mind the big picture is still part of your immune system. So if we strengthen the immune system, you're less likely to be triggered by these allergens. Other allergens to think about. So again, think total load, right? If you love, your kitty, your doggy, any pet that you're allergic to, this isn't the only factor. Picture that bucket again. So one of the factors may be food allergies, but what if you're constantly exposed to environmental toxins? So check out what you use to clean your home. If you're constantly using chemicals, that is a toxin for your immune system. So make sure you use as many cleaning products, like vinegar is a great cleaning product. You can use tea tree oil diluted with water, use that as a cleaning product. There's a company called Seventh Generation. They tend to produce a lot of good products. Mrs. Meyer's, Whole Foods or Sprouts has a lot of the good cleaning products that are not toxic. So you can see things like xylene, benzene, gasoline-like substances, things in your cosmetics, lotions, things that we put on our body and it like soaks through directly, doesn't even pass the stomach to detoxify or the liver. So all of these play a role in offending our immune system. So again, to prevent the environment being the only problem, try to reduce the load of your body from eliminating these toxins out of your system. Other examples, rubber. So never microwave plastics. That's another source that releases chemicals. Plastic, rubber, textile, paints, aerosols, automobile emissions, tobacco smoke, contaminants in water and soil. How often are we exposed to these? So try to limit our exposure to these as much as you can. Other ones, you've heard of phthalates. They're actually quite rich in fragrances because they extend the smell. So they're really strong in nail polish. They prevent it from chipping. They actually are in some of the drugs because it's more of like a slow release. It slows down the release of the pills. But you could see they actually disrupt hormone activity. They can cause birth defects. And they're really rich in children's plastics. So now you might see certain plastic that say phthalate free. So more and more information is coming out of these to find products that are phthalate-free. So nail polish can be phthalate-free, fragrances, deodorants, hair gel, mousse, sprays, lotions, medications, things we use every single day. You want to make sure they're clean products. Other ones, parabens. You'll also see products that say paraben-free, so definitely look for that. It's another hormone disruptor, so it's very rich in cosmetics and creams. It's also high in soaps, shampoos, toothpaste, so look for things that say paraben-free. And then other ones are heavy metals, like mercury, lead, aluminum. Make sure your china, like the dishes you use every single day, aren't from, there's certain countries that don't check for lead or certain brands. So make sure you get a reputable company that's not using lead in Chinaware. Aluminum is another big one. Mercury you can sneak in through eating like sushi every day or through eating big fish. So definitely make sure you're not exposing your body of heavy metals because they come with costs, right? And by the way, cadmium's really rich in cigarette smoke. So again, lowering your exposure to all of these. Other ones, vaccines, pesticides, most antiperspirants are rich in aluminum, and dental amalgams, the mercury fillings. And you could see they do everything. They're potential cancer causing. They cause potentially neurological disorders like Alzheimer's. They can affect foggy brain, fatigue, nausea, vomiting. They can affect red and white cells. Some of the leukemias have been linked to heavy metal toxins. They can affect your blood pressure. So there are some cases where if they have heavy metals, they can have hypertension. And if we eliminate that, it can actually reverse. So again, I'm gonna visit the bucket again, right? How many things did we talk about that if it just keeps building and building and building, your immune system says, I can't do it anymore, I can't take it. So we wanna reduce the effect of the immune system reacting to these substances so that it can have a chance to breathe. Okay, so let's now talk about how to test for allergies. Have you guys heard of the skin prick test? Some of you may even had it done. It's a very common one. So there's a time and place for it, and I'll talk about when it's good. There's also the blood test for allergies, and then there's the allergy elimination diet. So you may know about the skin prick test. It's basically what you see in these vials are common allergens that we use to prick under the skin, and we wait about 20 minutes and we look at the skin to see if there's a reaction, what we call a wheal, like a redness in the area. If there's a reaction, we know that the body's allergic to that agent. So it could be anything from pollen to certain trees to dust to pet dander. They usually check it for a lot of different environmental agents, and I like it for that, but I don't like it for food. So if you guys have done it for food and your doctor says you probably don't have a food allergy, keep in mind this is only good for IgE. Remember I talked about IgG and IgE? This only checks IgE because that redness is histamine, and IgG doesn't check histamine. So I don't like it for food. I like a different test for food. But if you do it for environmental, you might get a lot of good information from it. Okay, so I pretty much mentioned that it's the most common method for environmental allergies, and it usually, you know, within 20 minutes the test results. So the cons, as I mentioned, is it doesn't test for IgG, but there's a little bit of risk too in that if you have an anaphylactic reaction to that agent, you know, you probably don't want to get it checked because it might trigger, you know, a lot of reactions. So if you know that you have a certain allergy, don't get checked for it. Just know that there's a potential risk. A lot of clinics that do this, they have like Benadryl or an epi shot ready just in case someone goes into anaphylaxis. And then, as I mentioned, it doesn't exhibit a strong correlation between a food allergy because it's a different mechanism. So for food related, I actually like two different ways. One is a blood test, or we could do the elimination diet. There are a few labs that check you for IgG allergies. I use at least one or two of them, but there's many out there now that are pretty good. They use a different style, what we call the ELISA, that it's a technique that picks the IgG-related food sensitivity. And what I like about it too is it checks you for about 90 to 110 common foods, and it gives you like a gradient. So if you have mild reaction, it's like, well, it's okay, no big deal. If you have like a moderate reaction, it kind of tells you you're eating this food too much, like just cut back on the frequency. And then if you have like a high reaction, you might want to take a break from that food. And what you find is when you eliminate it, it takes a load off your immune system, and anything that you've had struggles with your health, you might find that it starts to reverse it. It also checks the same test for environmental pollutants, but again, the skin prick is pretty good. And then it also could check for candida overgrowth. So can the, what's it called? Ooh, losing my voice. So can the stool analysis, but some labs check for yeast. Okay, so these are some examples that they check you for. Dairy, you could break it down to like different cheeses, yogurt, goat milk, cow's milk. And then the fruits could be like berries, pears, apples, citrus foods. Citrus is a common allergen that I see, but other foods tend to be okay. Excuse me. And then grains. So the grains can be broken into like gluten. So it could be like wheat, barley, spelt, and then it could be like a non-gluten. So I'll check you for quinoa. I'll check you for, let's see, rye has gluten. Like buckwheat, it'll check you for. It'll check you for teff. So there's different grains that are non-gluten, and you can get checked for that. And then legumes, so it'll check you for like, you know, kidney bean, white bean, black bean. Sometimes I see kidney bean reactions. I think it's because we focus too much on just eating kidney beans only, but there are so many other variety of beans. So again, the point being, there's so many kinds of foods out there, and if we fix it on just one, we're gonna develop allergies. So mix the legumes. Nuts, the most common one I'm seeing more and more is almonds, and I think it's because we're recognizing we have peanut reactions and we're overeating almonds. So again, just eat as much variety as you can. I rarely see problems with seeds. They'll check you for seeds too, but I rarely see a problem. Rarely see vegetable allergies. I can't even recall a time. Meat, again, very rare. Sometimes I see it to eggs. Actually, a lot I see it to eggs, so egg white and egg yolk. So the lab will check you for that. And then fish, again, very rare. The kind of fish that you might be thinking, like people say I have shellfish allergies, that's IgE. It's not the IgG I'm talking about. And most people know, like they eat the shellfish and immediately like, oh, I need an EpiPen or I need Benadryl. So that's a different mechanism than the delayed foods. And then you'll also get randomly checked for like sugar, yeast, coffee, cocoa, that sort of thing. And I mentioned candida because a lot of people have chronic yeast infections and they don't know that they're actually reactive to candida. So if they eat a low yeast diet, like if they limit breads or they limit sugars that feed the yeast, they'll find that they actually do better. Even cheeses like moldy cheeses or mushrooms or peanuts, cantaloupes, there's certain foods that are more mold prone. So it's always good to address yeast and the element of food reactions as well. The other kind that I like is the allergy elimination diet. That's actually the gold standard for food allergies. The benefit of it is it's free. You don't have to pay a lab to check for you. I like doing both the lab and the food allergy elimination because you could see on paper that there's a food that's showing your immune system reacting to, but then when you actually eliminate it and you notice you feel better, and then when you add the food back and you feel worse, it's like validation that indeed, this food was affecting me. Typically, it's about a 2 to 3 week period where we eliminate the suspicious foods. So the foods, the most common food allergies are gluten, dairy, corn, soy, eggs, and anything that you may be eating more than 3 times a week, and vegetables and fruits and things like that. But in my case, I actually did suspect almonds because I was eating almonds every day, and I thought, okay, I know nuts are a common allergen, let's get rid of it, and indeed it was a reaction. So anything that you suspect that it's kind of on the borderline list, just get rid of it and see if you notice an effect. So a lot of people, when they get rid of those foods in the 2 to 3 week period, they notice a difference. They notice that their energy's better, or if they had eczema, it's starting to clear, at least there's no eczema coming back, or maybe their congestion's going away, their headaches, their migraines, all these chronic things they may have, it's like lessening. And I usually recommend, if it's continuing to get down, go past that 3 week period. Just keep going till you plateau. You get to a point where it's like, okay, my symptoms have really come down, and they're not coming down anymore, but at least I know that there's something I took out of my diet that may be a trigger. So then the next part is what we call the challenge phase. And the challenge part is we add one food every 3 days. And you guys might know now why it's every 3 days. Remember we talked about that 72-hour period? So we want to give the immune system that length of time to be able to show a reaction. And by the 72 hours, if you don't have a reaction, most likely you won't. So it's one food every 3 days. You only eat it on the first day, and then you wait 2 days. You're basically just giving the system a chance to respond to that. And it's one food at a time. So let's say that you ate a pizza and you had a reaction. You might be thinking, okay, was it the gluten in the pizza? Was it the cheese? Was it maybe the tomatoes? Like, you don't know. So it's good to just do one food at a time so you don't suspect that might be multiple things going on. Once you identify that food as a problem, it's not a life sentence. Many people have had strong reactions to a food, and at some point when they give their body a chance to heal, they get away with a little bit at a time. And they kind of are so bonded with their body that they know how far to push their body until the body says, okay, stop. Nice try. So I usually say get rid of that food for 3 to 6 months, actually. Give your body a chance to heal, and then let's add it back and see how you do. And a lot of people are able to tolerate some. So it's a good chance to connect with your body. The most common question I get, and it was actually the first question I asked when I learned about this, is how come I've been eating this all my life and not known that I had a problem? This is part of what's really amazing and yet fascinating about our body is like we get used to things even if they're bad for us, our body adapts. So rather than feeling like crap all the time with something it can't handle, it actually adapts to that food and it just kind of resets. So most people can put up with something that's bothering them, but as soon as they stop eating it and their symptoms lift off, they're like, I had no idea I could feel even better than I was. So especially fatigue or like head, foggy brain, that sort of thing can lift for a lot of people who have food allergies, but they might even put up with like chronic migraines or hives or eczema and not know that there's something they're doing every day that's playing a role. So with any kind of allergy treatment, we again go back to treating the whole person, and we always want to find the cause. So in this case, the cause could be the agent that's, the allergen that's offending the body. We also want to address the digestive tract. So you can see part of it is, yes, remove that agent, but also strengthen the digestive tract. Because the stronger your digestive tract, the more your body can at least put up with a little bit of it here and there. A good example is for some people, they have such bad gluten sensitivity that even a little bit of gluten could throw them off. For others, it's not that small. They can have even like a little piece of bread once a week and no problems. So there's like a big level of reaction or sensitivity different people have, but the stronger you make your immune system, the more tolerance you may be able to have, more wiggle room. So again, strengthen the immune system, and then really look at your lifestyle. So a lot of times people notice that when they eat poorly, when they haven't slept well, when they're more stressed, they're more likely to have food reactions. So what I say to people is if they're traveling a lot, try to control as many factors as you can, because you're already outside your comfort of your home. You're traveling a lot in an airplane, or you're in a hotel, your diet's different. Just try to eat as cleanly as you can, because most likely you might be sleep deprived or there's a lot of stressors going on, but your diet may be your foundation. Okay, and then with the environmental aspect, again, try to really put yourself in as clean of an environment as you can. So again, we're talking reducing the total body burden. This could be like changing your carpeting. We don't realize how much the carpet can hold on to dust, or so I'm a big fan of hardwood floors for that reason. At least you can see what you're cleaning. Pillows and mattress covers. Some people even get like a hypoallergenic pillow cover if they're allergic to the pillowcase, to the pillow itself. Cleaning the heating vents. So that's a big one for the winters, because we're in a closed environment and we're just recirculating the same air. So definitely take a look at that. Check for mold. Clean, make sure the water supply is clean. That's another area that's disturbing. I wish I could just open the tap water and drink straight out of it, and it's just getting harder to do that. So like a reverse osmosis system would be a good idea. Avoiding chemical exposure. So it amazes me how many people use these things like air fresheners, fabric softeners, chemical cleansing agents. The reason they have a strong odor is that they're chemicals. So try to use as many natural products as you can, because again, that plays a role in your immune system and your allergies. If you do have allergies, a HEPA filter is a great way to clean out the air and to kind of get rid of the the allergens that are floating in the air. That way the filter gets rid of it before you breathe it. So it's a really good one, especially if you're sleeping all night. It could kind of be on your side. Couple books that I really like. One is Home Enlightenment and Home Safe Home, and it kind of goes over in more detail these areas. I hope it's in your handout. I don't see it either. Sorry, but I'll just leave this up for a little bit. That's too bad. Okay. Everybody got that? You could email me if you need it on an email format. Okay, so nutrition-wise, this is really the foundation for any health topic I give, is make sure you eat organic foods as much as possible, especially if you're trying to prioritize. Go to ewg.org, and under there, type Dirty Dozen. So EWG stands for Environmental Working Group, one of the best websites I've ever come across. They even give you a list of the cleanest chemical agents, the best cleaners you can find that are free of chemicals. So you'll get a list of products that they recommend. They'll give you like the worst cleaning agents that you can avoid. But I like it for food as well, because the Dirty Dozen is basically the top 12 foods that are rich in pesticides, and then there's also the Clean 15, things that you don't necessarily need to get organic, and you could get them conventionally, and it's not high in pesticides. So I really like that resource. Eat about 6 to 8 servings of vegetables. I think vegetables are like the nature's best kept secret, because you can't really substitute the wisdom that leafy green vegetables have. Not in a bottle, not in any other food groups. Really, vegetables are so great for your immune system. They're rich in so many nutrients. So try to get as many as you can every day, and then make sure you drink lots of water, because again, it's like a purifying agent. So water can help get rid of allergens in your system. Avoid packaged foods. Again, I think processed foods are a big reason we're developing allergies. Avoid drinking alcohol with meals, because that can actually affect the lining of your gut. So that leaky gut we talk about, you want to do the best that you can to enhance digestion. So limit that. And then don't overcook your foods. You know, you're best off like kind of slow cooking your food. Don't like crank it at high temperatures, and you know, it loses some of its nutrients. Okay, and then a really big one is to eat in a relaxed setting. I have this chart that I didn't put up here, but it divides your nervous system into parasympathetic and sympathetic. And the sympathetic nervous system is that fight or flight. So when your body's under stress, your nervous system's like run for your life. And the organs that are active are your heart. Your heart rates are speeding, your lungs are open to exchange oxygen, your eyes are wide open, and you're like ready to run for your life, right? The last thing the body wants to do is sit down and digest. So your digestion can actually shut down. And if you're eating in a rush setting, you're putting your body in that same scenario. So when you're eating in a relaxed setting, your body's open for digestion. And that's actually a really big one, because a lot of people eat behind their desk, or they're eating in their car, or they're rushed. And a good digestion affects your immune system, right? Because 70% of your immune system's in your gut. So those two go hand in hand. Chew your food. You don't know how many people come in and they have indigestion, and I'm like, how many times do you think you chew your food? And they first of all have no idea, but they think maybe like 15, 20 times, and I'm like, well, it should be 30 to 40, average 35. And just, you know, digestion begins with your mouth, so definitely pay attention to that. And when we're rushed, we inhale our food practically, right? So pay attention to that. And then avoiding distractions. We tend to actually eat more when we're stressed, so just again, pay attention to digestion. And then this is a really big one, eat as many variety of foods as you can. So here are some examples. Actually, it's coming up. Let me just go over this first. I also mentioned high fructose corn syrup, because I think that's another reason we're developing food reactions. It's everywhere, and we really need to make sure we watch for it. Corn is pretty much genetically modified to begin with, but high fructose not only affects our digestion, but affects our organs, our endocrine organs. So it affects our pancreas, affects our liver. There is a potential that pancreatic cancer can be related to fructose. So they're cancer-causing agents, and they're really rich in a lot of the junk foods that's out there. So definitely watch for that. They're the big reason that people get heart disease or obesity or diabetes. So a good natural sweetener could be either stevia, xylitol, raw honey, or pure maple syrup. I mean, even pure organic cane sugar is better than high fructose corn syrup. So now that we're talking about food options, let's look at other food substitutes. So remember how I said a lot of people have kidney bean reactions? Look at every single other bean. We've got lima, navy, pinto, red, string bean, white, azuki, black. I mean, I could just go on and on. There's so many different kinds of beans, and we focus on kidney beans a lot. And I think that's why I see more reactions to that, is that we tend to only focus on one thing. So eat as many variety of legumes as you can. It's also a great grain alternative. It's rich in fiber, rich in protein. It's better for your metabolism than eating grains. So try to increase your sources of legumes, especially lentils. They tend to be very good, or chickpeas. What's that?
Mung beans.
Oh, mung beans, yes. Mung beans are delicious. Yeah, absolutely. So has anyone tried amaranth? Yeah, they're pretty high in a variety of gluten-free meals. It's actually delicious. I love the taste of it. It's like really nutty, and it is gluten-free. It really tastes good in a lot of the baking and pasta. It again has like a very nice nut butter flavor. I've seen it in a lot of kids' cookies as well, if that's gluten-free. But amaranth is an example of a gluten-free grain. So is teff. Anyone try teff? Teff, if you go to an Ethiopian restaurant, it's the main bread that they eat. Look at, originated in Ethiopia between 4000 and 1000 BC. It's an ancient grain, and it's very rich in nutrients. It's high in calcium, phosphorus, iron, copper, aluminum, not the toxic aluminum, but just the mineral, barium, thiamine, high in protein, carbohydrates, and fiber. It tastes really good. I've had it before as a bread form. I had a friend of mine make it as a gluten-free brownie, and it was like the best thing I've ever had. So you could definitely use it as a gluten-free substitute in baking or bread. Another one is arrowroot, and arrowroot is a good substitute for cornstarch. So if someone has corn allergies, you could definitely use that. It's basically a thickening agent, so you may see that in sauces or pies or certain fillings and puddings. It's basically a plant. It's a plant extracted from the West Indian plant, Maratha. And then this one you guys are probably familiar with, quinoa. It's actually considered a high complete protein. So many proteins you have to, like beans aren't a complete protein, and neither is rice, but if you mix rice and beans, it's a complete protein. This one's actually complete, so you can eat it by itself and get all your amino acids. It contains all of your 8 essential amino acids, and it really is easy to cook. So I sometimes find it easier to cook than rice. So it's one of my favorites. It's low glycemic. It's a lot better than rice if you're pre-diabetic or diabetic and you're trying to watch your blood sugars. That said, not to put rice down because you can see it's the world's largest crop. I rarely see reactions to rice. Most people are able to tolerate it. So it's allowed on the allergy elimination diet as like a culprit. And you've seen some substitutes like rice milk or rice flour be used as a gluten-free substitute. And then other wheat substitutes, you could do buckwheat, millet, barley, and oats. Keep in mind barley does have gluten, but some people only have a reaction to wheat in the form of gluten. If you do have a gluten allergy in general, I wouldn't recommend it. But I've seen some people get away with some barley and the wheat. That's a bigger problem. Oat by nature is gluten-free. It's just there are a lot of companies that make it in a manufacturer that cross-reacts with wheat. So there are a few brands that say gluten-free oats, just to double check that it's a different manufacturing. So the point being that nature has provided a whole variety of foods, and we should eat as many varieties as we can. I think another reason we're developing sensitivities is that in the past we used to eat seasonally because we didn't have a choice. I think with exporting and importing, we have access to peaches all year round, or to, every food almost every single time of the year. Whereas when we used to eat seasonally, by nature, we were eating variety of foods. So you can kind of force that on yourself. Try to eat as much variety as you can to prevent your immune system getting used to it. Especially, remember I pointed the common food allergens, wheat, eggs, almonds, dairy. Try to limit those as much as you can. Don't eat it all the time. That way your body can, not develop allergies. We can develop allergies at any point in our lives, and we can outgrow it. So there's, it can go both ways. Okay, so what can we do to lower our reaction to allergies? So I really like probiotics. So this could be lactobacillus or bifidobacterium. A lot of the good strain of probiotics have both. Omega-3 is really good at reducing inflammation, so you could either take fish oil or flax oil. I like it in liquid form. I know some people don't like the taste of fish, but the companies are doing a great job hiding the taste. So if you can actually take it in a liquid form, you don't feel like you're popping pills all the time. You can actually just, a tablespoon, sometimes about 3 to 6 capsules, so it just saves you from swallowing all the pills. If you absolutely can, just make sure you match the amount of the capsules to be about 1,000 milligrams of EPA. That's kind of the dose for like an anti-inflammatory benefit. And then vitamin C is actually great. It can lower histamine response. So, you could supplement with it anywhere from 2 to 6 grams in divided doses. You might find that when you're sick, or if you have allergic reactions, you can tolerate more vitamin C, because too much vitamin C can cause diarrhea, but when you're sick, your body's like soaking it up, like it actually needs more. So you can kind of see how far your body can handle it. We call it bowel tolerance, and then just kind of assess that. So some people can go higher than 6 grams, but I'm just giving you an idea. Foods like broccoli, peppers, Brussels sprouts, parsley, citrus fruits, and strawberries are really rich in vitamin C. Zinc is also great for strengthening the immune system. So it's rich in certain meats, eggs, seafood, black-eyed peas, pumpkins, tofu, and wheat germ. So quercetin is rich in apples mainly and onions. There are other foods like green tea, grapes, citrus fruits, broccoli, but the main two that we know of that's the highest source is apples and onions, and it makes me think apple a day keeps the doctor away. The reason it's really great is that it reduces the effect of histamine in the body. It's very great for an allergic reaction. So I actually use quercetin in a supplement form for someone who has allergies. And you could see like dosages of like 500 milligrams 3 times a day. So I really like it in terms of treatment element. Or cooked, yeah, they don't really specify, it's just rich in onions, yeah. And again, we know that onions in a way are like nature's antibiotic and they're great for the immune system. So it just kind of encourages you to cook your foods in onions. What did I just do? Oh, okay, good. So as promised, we're going to talk about homeopathy a little bit today. It's actually one of my favorite modalities to practice. How many of you are familiar a little bit with homeopathy? Just raise a hand. Okay, so actually a good amount of people. That's great. So homeopathy, in a way, it's a different way of thinking than we do with vitamins and minerals. Vitamins and minerals are more from like a physical, biochemical mechanism, whereas sometimes with homeopathy we don't even know exactly how it works. It's a lot deeper than that. It's almost like an energetic element. The way we know it works is that it's like a microstimulation that's basically stimulating your body to heal itself. And the stimulation takes place by looking at the essence of the substance. So there are homeopathic remedies are made from different substances in nature. They could be made from minerals, they could be made from plants or animal substances. For example, you may have heard of arnica. Some of you have heard of, so arnica is a plant. Arnica as a whole is a very toxic plant. You never see arnica supplements sold, but you might see a homeopathic cream or you might see a homeopathic pellet of arnica. And the reason that's safe is that it's diluted so much that if the term Avogadro's number sounds familiar to you, you might know that it's basically the number that reflects that it's beyond measurable. The physical substance is no longer there. So it's diluted so much that we say that it's actually just water, but the memory of the original substance is almost etched in the water. So when we check for the properties of these, we actually give them to healthy individuals. And we see that it could trigger symptoms in certain individuals. An example would be like a very obvious example. You know when you chop onions, what happens? Your eyes tear up and your nose is runny, burns, right? If someone has allergies of that similar quality, their nose is running, it's like a faucet they say, and it's burning and their eyes are like watery, we can make a homeopathic preparation of an onion and it can actually cure their allergies. It's beyond just taking antihistamine every day. So if you match the quality of the homeopathic to the physical symptom of that person, it actually creates a stimulation where your body starts to heal itself. So this is why arnica, for example, is okay to take in a homeopathic form, because we know that it's been diluted so much that it's no longer the physical substance causing the toxicity, it's just the essence of it. And the essence of arnica is that it's helpful for any trauma-related reactions, whether it's ankle sprains, ankle strains, any bruising, swelling, post-surgery, if there's like healing to be done, it's really great for those kind of reactions. So every substance in homeopathy has a certain characteristics, and the more we understand that and the person in front of us, we could match the two. We call it like cures like, and we can get a reaction. So what I'm going to do is just give you a few examples of some homeopathic remedies you might want to consider, and just some of the common traits of those remedies. It's best to probably consult with a doctor that specializes in homeopathy, whether it's a naturopathic doctor, a homeopath that's classical certified homeopath, or some medical doctors practice homeopathy, because it's a very delicate understanding. Sometimes it's hard to self-diagnose. But for some of these acute reactions, you might be able to pinpoint your own. So before I talk about this, actually, what's really fascinating about homeopathy is that there's different remedies for the same diagnosis of allergies. So if you go to your conventional doctors, you say you have an allergy, they'll probably give you like Zyrtec or Claritin, like some kind of antihistamine. It's very cookie cutter. Here's the diagnosis, here's the drug, off you go. With this, there could be one person who has allergies and we can cure their allergies permanently, and they're like, can I give this to my friend who has allergies? And you might say, well, it depends on what their symptoms are. They might have allergies diagnostics, but their symptomatic expression might be different, okay? So let me give you some examples. Let's look at Allium cepa. This is actually onions. It's the Latin word for onion. What's really characteristics of this is if you have a perfused watery eyes, your nose, which like I said, it's like runs like a faucet. A lot of sneezing, swollen mucosa, so it's like your nose is running, but it's also blocked. It's kind of like an ironic thing, right? And your symptoms are worse at night and in warm temperatures. So if you look at that and you can say, okay, well, I can see that, but this person, it almost sounds similar, but you can see this person's worse at night, this person's better at night. So if you see a homeopath and they want to know when are you better and worse, and whereas other doctors are like, I don't care when you're better, but you got allergies, take this, off you go. These subtleties make a difference in assessing the remedy. So we look at the next one, euphrasia. This is actually a plant. It's also known as eyebright. So it kind of gives you a hint. It has something to do with eyes. It tends to be good for those who have more irritated eyes. It tends to be running, red, burning, itching. They wake up in the morning with like crust in their eyelids, and there is still some sneezing. So there's allergy symptoms, but it's more around the eyes. And they're also sensitive to light, so photophobia. You might want to look at the homeopathic euphrasia. Pulsatilla is also a plant. This tends to be more chronic allergies, but they're worse like springtime. It's more like a hay fever in the spring. And they tend to be warm people, like warm temperature wise. So they're, they get aggravated in the heat, but they're also run warm. Their symptoms are like more itchy, watery eyes, and it's better with cold applications. And then this is another big one. A big keynote for this is, the type of people who have allergies that sneeze like for a whole minute, like one attack after another, and you can't even talk to them. You're like, I'll give you a minute, That's the kind of intense sneezing I'm talking about. You can see is as much sneezing on there. This is intense sneezing. So Sabbatella tends to be that kind of allergy attack. There's some itching, tingling of the nose. There's some nasal obstruction, and then they tend to be really sensitive to smells. And then another one, this kind of fits not only just allergies, but it's a really good one for chronic sinusitis. That's more like infectious. So you can see the Calibichromicum is the remedy, and it tends to be with like thick green mucus that has, tends to put pressure in the sinuses, and it tends to be pain around the root of the nose, and sinusitis is a big one. So this is a very crude list. There are, hundreds and thousands of remedies out there, and we can use homeopathic remedies in an acute sense, in this case, treating the allergy itself, or we can use the whole person treatment called constitutional homeopathy. That the second one is my favorite way, because when we treat the constitution, not only does the allergy go away, but certain other perhaps ailments you may have that's related to the whole person. It really treats the person. It stimulates the body to heal itself as a whole. So I absolutely love homeopathy. The other question that commonly comes up is like you might see like combination remedies. Some people swear by it, others don't. It's a hit or miss. That's the only reason. They usually put the most common homeopathics in a combination, and some people, if they have a strong tendency toward one of them, they tend to get somewhat of a relief. But you're better off doing only one remedy at a time. So if you find that some people say, I swear by this, it's really helped me, but it didn't help you, it's because there's individual variances based on your symptom manifestation. Okay, so that's one area where homeopathy is really helpful. The other thing that I like is, as much as I think homeopathy works amazingly at the root cause, and no side effects, it either works or it doesn't, but you also want to remove the obstacle. So if you're putting your body in an environment where you're constantly exposed to allergens, or your nasal tract is just congested, you might want to clear it, and then the remedy works a lot more effectively. So that's why I put, neti pods. You guys may have heard of neti pods, or just doing like a saline rinse. It really helps to clear your nasal passages so that your body's not constantly getting offended or getting inflamed. So that's another one. And then just, your lifestyle. So again, as much as I think homeopathy does wonders, you want to do the right things every single day, right? Eat right, sleep right, think right. Your diet and lifestyle, stress management plays a huge role. And then almost with every case, we always say we live in a fairly toxic world. There are just so many things to clear our body. You want to make sure your liver can handle it. So we always talk about treat the liver, treat the adrenals. That's the organ that helps to cope with stress. So those are the two other organs that I focus on. So we could do foods that help reduce the body burden of toxins, and then we could do adrenal support that helps you cope with stress. So this is really like a good treatment that I focus for people when they're going through some kind of an allergic reaction. So the summary is that we always want to treat the person, not the symptoms, and I think the homeopathy was a good example, right? We don't want to give everybody just Claritin, but if we can just find individual symptoms is the best. Identifying and treating the cause, so eliminating exposure to the allergens, and then really just helping to treat the gut, and then eating a rotation diet. I didn't mention that term, but rotation diet's basically that any foods that are a common allergen, don't eat it all the time. Eat it like maybe 2 or 3 times a week or every few days. Just rotate your foods. And a lot of people who have food allergies and they've cleared it, I say, well, just eat it on a rotation basis. That way you don't restart the whole process again. And then, we talked about herbs and nutrients, especially quercetin is really good for the allergic response, and then homeopathy, and then exercise and stress management. So, wow, time flies. That's all I had, so maybe we'll just do question and answer. Right.
How can you measure the bacteria in your gut?
Oh, yeah, that's a great question. So, yeah, so how do you measure bacteria in your gut? There's a lab that checks the stool, and we can check basically when your intestinal flora, when we have a bowel movement, we can actually see how much of it is in the stool that way. It doesn't tell you the amount, but we've been able to find basically like not like the numbers, like how I said 3.5 pounds. It won't say you have 2 pounds instead of 3.5, but it'll tell you whether it's mild, moderate, or high. So for some people, they're kind of on like the borderline. We say like it's better to supplement a little bit. I usually say for every course of antibiotics takes about 3 weeks of probiotics. So that's like a good rule to follow. But the stool analysis will check for that. Yeah. Mm-hmm.
Probiotic foods, are they a good way to increase that, like different kinds of yogurts that claim probiotics?
Mm-hmm.
Do they work?
Do they work? Yeah, it's a really question too. So probiotics in yogurt, or I wish they would label the amount. I don't think it's in the billions, and it really depends on the quality of that brand. So the quicker you make something, the less it has time to culture. So I think if you made your own yogurt, I have more faith in, especially if your base is good. But I think a lot of the conventional yogurts, I don't think they're that high. I don't have numbers for you, but I think if you have had a history of taking antibiotics, I would suggest actually taking a supplement. And this is coming from someone who's not as pro supplements, but I think I think food should be our medicine and supplements as necessary, and in this case, I think it is necessary. That said, I think kefir is better than regular yogurt. That tends to be a little bit higher. And then, certain fermented foods like, let's see, like sauerkraut, yeah, would be a really good one. Kimchi.
Like you said, supplement. Or supplement?
Probiotic supplementation. Yeah, so a good probiotic supplement would have like lactobacillus and bifidobacterium. Those are the two most common. Yeah. Mhm.
Do you have a place you recommend that's reasonable on selling supplements, but is still selling good supplements? Like, is there a price club for supplements?
Yeah, I think, Whole Foods, I'm impressed with Vitamin Shop. I think they do a good job filtering. GNC, I'm torn. I can't really find good ones. We're being recorded. This is great. It's my opinion. Sprouts, the mom and pop health food stores, I think they do a really good job picking quality. Depends what you're looking for. Like, I'm really happy with Nordic Naturals and Carlson's for fish oil, but they don't make probiotics. Jarrow makes probiotics. So different companies are known for certain things than others. I do have a supplements class where I can help you decide, how to choose. In general, you want to, as much as you can, avoid tablets, because tablets don't break down in the body easily. So capsules are the best form, or powders or liquids. And you want to make sure it's clear of like food coloring, magnesium stearate, of I see titanium dioxide, BHD, a lot of like these chemical preservatives. So yeah, I don't know when the next supplement talk is, but it kind of we go through like a checklist of like how to decide on a good supplement, but definitely make sure it's clean. And the tablets are my least favorite. Yeah.
And also, I'm surprised I didn't hear CoQ10 or 5-HTP. What are those for, and are they good for anti-inflammatory?
CoQ10 is fits into your metabolism in terms of like your muscles. So every single cell of the body has what we call mitochondria, which is the powerhouse of the cell. And CoQ10 basically fits into what we call the carnitine shuttle. It's where energy gets produced. So it's really good for people who have some kind of like a mitochondrial energy deficit, whether it's chronic fatigue, fibromyalgia, arrhythmias like congestive heart failure, some kind of like a heart beat arrhythmia problem. So it's good for helping contraction of the muscles. Has it helped allergies? I'm not sure. I don't see the mechanism helping with histamine response. I don't know how it helps with lining of the gut. Like in that sense, I can't make that leap, but it's good for energy production. Same with 5-HTP. What's interesting actually is the majority of serotonin is in our stomach. And we always, do you guys know about 5-HTP? It's basically the precursor to serotonin, which is one of the neurotransmitters that we call the feel-good chemical. So our brain and gut have a huge relationship. The nervous system and the nerves in our gut are very much connected. So, and there are a lot of tryptophan receptors in our stomach. So sometimes we even say that, the reason people get depressed if they eat poorly is that there's that brain-gut relationship. Would I give someone 5-HTP for digestion? Probably not. I would probably want to optimize digestion so that the body's naturally absorbing foods and making its own sources of 5-HTP. I'd probably think of 5-HTP more for, like depression-like symptoms, or sometimes it helps with sugar cravings, but I want to make sure that they're not just over-prescribing, because some people have normal levels of serotonin and they're just taking it because they heard it's good. So again, it has to be appropriate to the person. Yeah.
Does it help with sleep?
It does help with sleep, yeah. So basically it goes 5-HTP, serotonin, and then serotonin converts to melatonin. So yeah, it does help with that, yeah. In fact, if someone's taking melatonin, I might just say, well, maybe try 5-HTP before melatonin. Melatonin's a hormone. I'm a little bit on kind of the edge about that. I'm like, well, if serotonin does the job, why do melatonin? Melatonin is good for more night shift workers or people who travel a lot, because it helps you kind of catch up to the day rhythms. In fact, a lot of people must know that they can't take melatonin in the morning because it really messes up with their diurnal day. So. Yeah, yeah.
And if I think I'm allergic to like pollens, is it okay to go outside, or go for walks and stuff? When is a better time to go outside? Is it okay to open the windows?
Yeah, so It's very individual. You might want to just, I think self-observation would be a good thing to do. You know, for some people, when it rains, it actually makes them feel better. It like clears the air. For others, it moves everything up. So it just depends how you respond. You know, pay attention to see whether you have a food sensitivity, because if you do, it's like one more thing your body has to deal with. So if you remove that, your body's strong enough to be able to handle the pollens. Do you have other things that you think you're reacting to, like any suspicion to food or?
Maybe, yeah, like
Yeah.
spicy food.
Okay. So you might want to do that elimination or test for food allergies, and if you get rid of those, you might find that your allergic response to pollen isn't as strong. Yeah, and you might have other allergies too. Like, is it pollen or is it like molds or dust? Or, you know, if it's dust, imagine like one more thing your body has to deal with. So keep your home clean. Like all the things I mentioned about, you know, a clean, you know, products, don't put any chemicals in your skin, or all of that plays a role. So really try to clean your environment.
So what do you suggest for lotion then?
There are a lot of good ones out there, like Cetaphil's good, Kiss My Face. You could just do coconut oil, you know, just get pure coconut and just put it on your skin. A lot of times, actually, good lotion comes from the inside. So if you eat like olive oil, flax oil, fish oil, you're lubricating from the inside. If you're hydrated, you're gonna hydrate your cells. Like, there's things we don't realize come from the inside, and we're like lathering stuff when all along you're dehydrated. So look at it from different angles. Yeah. Mm-hmm.
What are good alternatives to Motrin and aspirin and naproxen? It seems like this
Quercetin.
Quercetin?
Yeah.
And anything else that you would recommend taking instead of these?
Yeah, there's also bromelain. Now, this is what we're talking about is anti-inflammatories,
Yes.
right? So fish oil is a good one. You could do bromelain. You could do boswellia. You know, homeopathy is a really good one. You know, again, it amazes us that you could take arnica for pain and swelling, and you know, your swelling might be in your arm, and you're taking something on your tongue, and it's going to help clear your swelling. Like, it's that powerful. So it's about treating the cause, right? You know, why is the inflammation happening? Where is it happening? So it's not just even about take boswellia instead of Advil. It's like, that's also medicating. It's like, why is it happening? And can we do something natural while we address the cause? It's a little bit of a different direction we go. Yeah.
You have any place where you can get your plates or tested for lead? Because almost every, I drink a lot of hot tea, and
Yeah.
everything comes from China, even the expensive.
Yeah, I don't, to be honest. I just try to focus on products that are made in the US. Yeah, yeah. I hear more, so this is just from my own observation with patients I see. The ones that I see high in lead, they've tended to use products not only from China, but Mexico. So getting rid of those two. I think products made in the US are a little bit more stringent in the way they make it. Yeah.
How about glass?
Glass is okay, yeah.
Instead
It's
of,
the,
you know, those mugs of
like ceramic, yeah, that's the big one, it's the ceramic, yeah, yeah.
I remember some place that where your food is touching, it has a color that sometimes is bad. Is that true?
Say that again, your food touches?
She thinks glaze.
Glaze.
Like a mug has a color inside, and where you pour water, it's black and outside.
Oh, yeah,
And
mm-hmm.
some people say that coloring is not good for you.
Yeah, yeah. Well, it's funny you say that, because sometimes they even use that in supplements. We got to watch out for that, to coat it. So we call that pharmaceutical glaze. Yeah. So it's,
Good evening. The library will be closed
yeah,
in 30 minutes.
it's a chemical.
If you need a new
Yeah.
library card, please go to the welcome desk now. Thank you.
This is the reason I'm not a fan of tablets, because they use that to hold the tablets together. And it's one more thing your body has to deal with.
So
Whereas,
get rid of any mugs that has color inside.
yeah, yeah, it's a coating. It's just one more thing. Yeah, yeah. I think is it like shellac? Do you guys know? It's basically what we use to furnish furniture. Yeah, so that's actually what tablets are made of. We call it pharmaceutical glaze. Yeah.
Have you heard of carrageenan?
Yeah,
In our
milks.
soy milk and all this?
It's a hard one to avoid.
It's supposed to defrost the windshield of the airplane.
Oh, that's great. Can't wait to drink it again. That's a tough one to avoid. It's everywhere. Every milk substitute I've seen has it.
Yeah.
Is it a thickening agent? What do they use it for?
Yeah, I think
Yeah.
it is. I don't know exactly.
Yeah.
Paraben, PA.
Carrageenan. Yeah. Yeah.
Even in Whole Foods, they sell soy milk,
Yeah.
rice milk,
Maybe that's
whatever.
the next
It's
hottest
genetic.
thing. Yeah. Carrageenan free might be the next label to look for. There are a lot of this free, that free. It's like one more thing. So, any other questions or? Well, thank you for coming. I'll send you guys an email with the next talk. I want to say it's May 7th on osteoporosis, but don't quote me on it. I'll send you guys an email. Okay.
May 12th, the last time. May
Oh,
12th
did I?
last year.
Yes, May 12th. Thank you, May 12th. Oh, you're so good.